Hi everyone, we are working with Aki for our CLS project. I'm Mirabel.
I'm Jasmine.
I'm Daniel.
And I'm Joanna.
I'm Marissa. And we have Liddy who's working off screen. Today we're going to be talking about HIV awareness, prevention, stigma, chemsex, and culture as well. So to start off, what is HIV? HIV stands for human immunodeficiency virus. It attacks the immune system, but more specifically cells that help fight off infection. Without treatment, HIV can seriously weaken the immune system over time, which can lead to AIDS. But thank goodness to modern medicine, HIV is much more manageable now than it was in the past. Considering that we have made such immense progress with HIV, uh, people with HIV can live long, healthy lives, but prevention and stigma are very much still big challenges here for the community. In Santa Clara County, a majority of the new HIV cases continuously affect HIV individuals, especially those who are gay and bisexual men, transgender women, and just many communities of color. Many of those will still face barriers to treatment and care, as well as judgment that may prevent them from getting tested or treated early.
So, when it comes to HIV, what are the best prevention methods? Something as simple as condoms. Condoms are still one of the most effective preventable methods to prevent HIV and other STIs for both male and female. Condoms are widely available and are often free through clinics and other community centers. Another thing that we can talk about is pre exposure prophylaxis, which is a daily pill and injection that can reduce your risk of HIV. PrEP, post exposure prophylaxis, is an emergency medication that is taken within 72 hours after possible exposure. U equal U, undetectable and untransmittable. If someone living with HIV is on treatment and their viral load is undetectable, they cannot transmit the virus. Harm reduction, access to safe syringe programs and substance use support helps prevent transmission for anyone who injects drugs. And the last thing would be to know your status. So regular testing is advised and it'll empower you and help break the stigma. Like I said, safe sex isn't just about condoms.
So now we're gonna talk about stigma. One of the biggest barriers to prevention, stigma creates fear and shame that stop people from getting tested or treated. Too often, people still associate HIV with moral judgment, punishment, or death, all of which are false. HIV is a medical condition, not character flaw. Many in the LGBTQ community still face discrimination in healthcare settings, workplaces, and even families. One local advocate shared, I wasn't afraid of HIV. I was afraid of how people would treat me if they knew that. That's why normalizing conversations about testing and treatment is important.
And the next subject will be based on chemsex, and it's just still an important topic to discuss still because it deserves to have an open judgment free discussion with this topic. Chemsex is using substances such as methamphetamine, GHB, and ecstasy to enhance sex or just sex and performance overall. For some people that do use substances for to engage in sexual interactions, it can increase feelings of connection of pleasure, such as dopamine. But it also raises HIV and STI risks because it can lower inhibitions just regarding just mental capacity of using safe sex methods such as condoms, like Jasmine had mentioned earlier, and just making safer sex less likely to happen within the LGBTQ plus spaces, especially among men who have sex with men, MSM. It can intersect with trauma and loneliness and internalized stigma. It's not just about just drugs and sex. It's more about coping and just having connections. The safer alternatives and interventions within chemsex is just access to harm reduction services regarding just drug use, so safer drug supplies, and just overdose prevention tools such as Narcan, or in case of fentanyl, there's also testing procedures for that. And also within just interacting with just sexual interactions with chemsex, just having just sober or low risk sex environments or communities, having a safer um, surroundings when you're doing that.
And also just having just the mental health and just peer support can make a huge difference. Just providing support and like reassurance regarding if anyone has concerns what the substances they use or what they're about to get into, and just more addressing like why does this happen, and just behind the behavior more and not like why is this like really happening.
Yeah, so for community support and solutions, the good news is that there are very powerful work happening right here in Santa Clara County. Local organizations are offering mobile HIV testing, peer support groups, safe spaces for LGBTQ youth, and PrEP navigation to make sure that prevention is easier to access. Schools and clinics or even faith groups are joining in on this because education and compassion is what will save lives and will continue to provide prevention. When we replace fear with understanding and compassion, we build community and connection in which everyone feels safe enough to get the care and support that they need.
So now I want to shift into how culture plays a huge role in HIV stigma and support for LGBTQ communities. A lot of us come from families where certain topics were never talked about, and that silence impacts people's mental health and safety. Because I grew up in a Mexican household where certain topics were just not talked about. Now that I'm a mom myself and someone who's healing from my own childhood, I can see how culture can be beautiful, the food, the family, the music, but it can also hold a lot of pain, especially for the LGBTQ community. People who grew up in families where being queer is seen as shameful or against family values, and the judgment pushes people into hiding, into anxiety, into silence. As someone who's, we're all studying public health, um, we want to create advocacy, support, and awareness.
Sorry, do you mind if I jump in? I have a little bit to say about the Mexican American community just because I'm part of it as well. Um, in most cultures, such as Mexican American communities, it's known to be frowned upon to be a part of the LGBTQ community, as well as to just speak out about it. Sex in general is a conversation that doesn't come naturally, and it's actually something that is meant to be kept behind closed doors. It's meant to just be a conversation just within your partner and yourself. Um, it's something that is very judgmental, and we're here to break those boundaries. We're here to talk about it. We're here to give you the power to speak out about your experience and to know that you're not alone.
Yeah. And just speaking on like the whole Asian American aspect of everything, I think we the similarities between our community and the Mexican American community is that we're the whole there's like taboo around sex and like asking about it or even just questions about it regarding it, especially the LGBTQ plus community. We in my family, I'm part of the community. I never spoke about my coming out with my parents until I was 16, and then we have never talked about it since. Like it has not been a topic of conversation about anything since I have come out. But because I didn't know where they stood, like what their views on the community were. I didn't know if it was safe for me to even come out, but I took that risk surprisingly on my birthday. I don't know why I did that, but I did it anyway. But I'm still here, thankfully. Yay. Um, but yeah, it's just a lot of taboo, and I don't think my parents really even care about it, to be honest. Because now I have a boyfriend. I don't know if they take that into consideration as part of my identity anymore. As someone who is bisexual, I don't think that whole bit of my identity is just locked in a box, and they don't talk about it. So
And to add along with what Meryl shared, especially coming from an Asian background, and it's just community, it's not spoken upon regarding like sex in general. I would say there's more acceptance of like someone's like wanting to like seek services. That like I mean, of course, a person or individual will actually feel much more safer to talk to someone within like a healthcare clinic compared to like any family members. Especially when it regarding to like the Asian culture. Just having old traditions, it's very hard to talk about it. It's not even something that should be mentioned unless it's regarding like related to school work. But over time, I do see a change within, I guess, generations regarding parenting towards just talking about sex. for my example, my parents, they're more modernized, so they do know that sex exists and that I'm gonna end up asking questions. Even my mom is open to talking about her sex life with me. Um, so it's a lot of change, and I feel like over time there's gonna be much more acceptance within most different ethnicities and communities out there.
The more that we break that stigma, it'll reduce the rates of depression and anxiety, and just being able to have conversations with everyone. It shouldn't be something that we are ashamed about. It's normal. It's something that we all experience one time or another in our lives.
Oh yeah, I feel like um, growing up, there's always been a narrative where parents would want their kids to marry the opposite sex, right? So I feel like because coming from a background where my parents were immigrants, I feel like they're very old school. So they never really looked into the LGBTQ side of the community.
I know we have some questions listed here. I believe we touched on the first one. How does culture influence the way LGBTQ people are viewed in various communities? But I was meaning to ask, what can families do in order to better support their LGBTQ plus loved ones?
For sure, just being able to have the openness to have a conversation that could be considered uncomfortable, you could be the first person that they need to rely on. It's very important to just have that initial trust and connection to be able to talk about something so openly. Because if it's not with someone that they trust, it's going to be with someone else within a clinic or a doctor, which is not bad. But you want to have the ability to be comfortable in your own home to be able to talk about something so sensitive.
As well, asking, I think it's important to ask the individual because you get to like get them express their feelings the way they see the outside because as parents we're locked in. We are just focused in trying to raise our children, and they're out there in the world figuring it out, like finding their own identity, and it's a lot for them. So I think as a parent, we also need to ask.
Just to touch base on a little bit about the cultural traditions influencing the way that LGBT people are viewed in different communities. I know it's kind of known in like the Mexican American community that we have what we call machismo. So it's very male dominated, and it has to be like this way or the highway. Male and female have a certain role, and that's something that's kind of just structured into our culture a little bit. But there are many times where people our age are just breaking those boundaries. They're creating new pathways, and they're trying to not follow the old traditions.
So now we're just going to talk about some stories that we found on Reddit just regarding chemsex and everything, just to get some like actual personal accounts from that. So we're just going to read off a couple of them. Does anyone want to read the first one? Do you want to read it?
So this came from a 39-year-old man who had a long and complicated history with chemsex. He entered a relationship in 2021 with a 29-year-old medical doctor. When they met, he was clean from drugs and trying to build a healthier relationship of intimacy, despite early red flags, controlling behavior, and a major boundary violation. Where Andrew went through his belongings, watched old porn videos of him, he stayed hoping the relationship could be built on genuine affection. But things escalated. Andrew pushed for more uninhibited sex, and although the narrator initially resisted turning to chemsex, they eventually began using drugs together. Andrew's status as an MD made the narrator feel falsely safe, especially as Andrew could prescribe medications to manage the after effects. Within a year, the relationship unraveled, arguments grew, and Andrew eventually admitted that he has been secretly smoking meth daily for months, far beyond the heavy weekend sex that they were already doing. The narrator felt manipulated and emotionally abused. Does anyone want to add on to that story or have any points?
Um, let's
I have one thing to say. If you are going to be intimate with someone, you have to make sure that you just put everything out on the table. Does not matter what it is. You want to have that trust with anyone that you're going to be physically intimate with, because it could affect them without even realizing it.
speaking of that, like trust, but also just like making sure that the person that you're having chemsex with, or just any sexual intimacy with, is that someone that you genuinely love. If you are in a relationship with them, make sure that this is something that is serious for the both of you. um, I know that that is something that some Reddit commenters have mentioned here and there, just like making sure that this person is someone you can trust, someone that you love, and just making that environment very safe for them to say no or back out whenever they feel, whenever they want to, but also making that experience very nice for them and pleasant.
Adding on to what Maribel had said from the Reddit, they had shared that just advice regarding chemsex is that if you're involving psychotic drugs or just adjacent stuff, and they also included weed in this, just to make sure that everyone's set and that they're setting down, that and ensuring that your place is comfortable and you've called your loved ones to chat for a bit and you're reasonably cool with who you are and who your partner is.
So add moose, edibles, ketamine, cocaine, LSD, shrooms, GHB, MD, MA. All are a blast if you dose and test properly, and have a good set setting and with someone you really connect with.
Again, it's just really important to have a safe space. If you do end up doing something like this, you want to create a safe environment for yourself. Stay hydrated, make sure that if you're in a room, keep the door unlocked for any emergency, have any readiness, like prepared procedures off to the side in case of, it's just a substance that maybe you're not used to and you're trying it out. We just want to make sure that you are safe at all times.
Yeah, and speaking on the various drugs or substances that may be involved, there it was a commenter we say and list some of the similar side effects that someone would experience if they were to use that substance during chemsex. Weed really makes it a more fun or heightened experience. Booze or alcohol, depending on the amount, may it all depends. I feel like everybody has different reactions to alcohol, so again, that's going to vary on the person. Meth as well. It's hard to explain, but it will give you heightened emotions, heightened feelings, which may be why people would choose that to use during chemsex. But also, shrooms and acid is also going to be in the same box as meth as well.
I have a story that I'd like to share. This was a part of our Reddit post, and they said getting high can make sex very intense. I still smoke, but there was this one strain I've never had, since that just really enhanced tactile feeling. I still fantasize about some of those times. I have to share. Not long after smoking, I would lay on the sofa in front of the TV. I would get horny and mention it to my girlfriend, who was laying on the sofa across from me. I would mention this, and she would say, I'm horny to give you a blowjob. So she would crawl over, move my shorts down, and really slowly bob up and down on my dick. The slower, the more intense it was. I could feel her lips and wet mouth envelop and slide along my chest. A few times I would just roll off the sofa and bake her doggy style, which was also intense. So as you know, this is not something that is usually a topic of conversation when it gets so in depth. So of course it just makes someone that doesn't normally talk about it feel uncomfortable. Just saying those different types of verbiage out loud. But again, we're here to break boundaries and to we're here to push the stigma of talking about such sensitive topics. So although we laugh, it's just uncomfortable, but we're here to break the stigma.
And for the resources, there is active and powerful work that's happening now in our county, Santa Clara County. There are local organizations that are providing more medical services, such as mobile HIV testing, and for more support regarding just social networking. There's also peer support groups and safe spaces for the LGBTQ youth to go to, along with adults as well. And just going back onto the medical services is also PrEP navigation, just to provide resources on exactly what is PrEP, just to make HIV prevention much easier. Along with regarding youth, there's school clinics and even faith groups that are joining in for those that do have a religious background. Just because education and just having compassion will save everyone's lives. And when we do replace fear with just understanding, we build stronger communities where people feel safe and belonged, just to continue to get care and support.
HIV does not define anyone. Stigma does. When we speak up, when we stay informed and support one another, we can end stigma together. So again, get tested, be able to talk openly, and have people that you can talk openly with, and just be supportive of others. Keep that open space and be, someone that they can trust and someone that you can trust as well.